Hello, my name is Stacey Tucker, and I'm here to teach you how to start an IV. I'm an RN EMT, been doing this for about 23 years, and I'd like to teach the paramedic student how to safely and effectively start intravenous therapy. First thing we're going to do is talk about our objectives. We're going to define and give a brief history of IV therapy. We're going to review peripheral versus central cannulation, discuss the types of IV needles to use, demonstrate the procedure for IV cannulation, discuss complications of IV therapy, and then lastly learn how to appropriately document IV therapy on the patient's medical record. IV therapy is actually the infusion of liquid substances directly into the body. And this is good for many ways. It can correct electrolyte balances. It can deliver medications. It can give blood and fluids if the patient is either anemic or hypovolemic. And it's also the fastest way to deliver fluids and medications. The best thing about giving medications through the IV is it has 100% bioavailability and it doesn't need to go through the GI tract to be absorbed, so it's absorbed much quicker. The history of IV therapy actually dates back to the Middle Ages, with the first experiment carried out they would use quills and animal bladders as their tools for starting the IV. And it wasn't until after and during the World War II's, World War I and World War II, that IV therapy started getting a more routine practice because it was used. The Army was using it to treat their wounded. What we're going to do is we're going to review the peripheral versus central cannulation. There's two types of cannulation we can use, and as paramedics we're going to be doing peripheral cannulation. We can do peripheral cannulation on any extremity, the arms, the legs. You can actually even do an EJ in the neck, and that's considered a peripheral cannulation. Central cannulation is where you're cannulating usually larger veins, which you cannot see on the surface of the peripheral. Those are your internal jugular, your subclavian, and then also your femoral vein. And that usually requires more of an advanced technique to do that, the Seldinger technique. Flight paramedics, specialized nurses, and then doctors are the ones that usually do the central cannulation. We have two different types of needles that there are out there today. The first one is the over-the-calf needle, which is the one that you're going to essentially see used in your practice today. There's a plastic catheter over the needle. You introduce the needle into the skin, and then you insert the catheter so that the catheter is flexible while it's in the vein in the arm. The other type is the butterfly needle, which they used back in the day. You still see some institutions using it, but not as much. It's just a steel needle that they place into the vein. The problem with that is it can easily puncture that vein if there's any type of movement. What we're going to do next is demonstrate the procedure for IV cannulation. What I'm going to do right now is I'm going to demonstrate to you how to start an IV. The first thing you want to make sure you do is you have your gloves on and you have the appropriate equipment that you need to start the IV. You have your appropriate size IV catheter, your lock, your flush to check for patency, tourniquet, alcohol pads, and some sort of securing device. So how we're going to do this is we take the tourniquet, place it around the patient's arm. And generally, I will say, especially out in the field, the best place and the first place to look is always the AC, because that's going to be the easiest and fastest way to get an IV started on your patient. You're going to take an alcohol swab, clean the area. And what I like to do is go ahead and prep my heparin lock and my saline, just so I can go ahead and stick it on there and get it ready to go. We're going to take the appropriately sized catheter, palpate the vein, tell the patient when you're ready to start. You're going to feel a poke. You're going to go in the skin at about a 45-degree angle. As soon as you see a blood flash, you're going to go ahead and introduce the catheter over the top of the needle. Then what you're going to do is you're going to place your other thumb over the top of the cannula so that way it doesn't bleed any further. As you can see, I've pulled out the IV and there's no bleeding from that catheter. Then you're going to go ahead and insert your HEPLOC cap securely, remove your tourniquet, and then flush your IV to check for patency. Again, sometimes you can backflash to see, make sure that there's some blood in the catheter, and that you got a backflash. Go ahead and flush it the rest of the way in. When you're finished, then what you will do is you're going to secure it, either tape or a securing device, so that way it stays in the patient's arm. And that is how we start an IV. The last two things I want to talk about after you've inserted your IV is just some complications that occur with the IV. The problem you have to worry about is infection. If you don't accurately clean that area off before you insert the needle, you can get an infection at the site. Phlebitis, there can be inflammation of the vein. A blood clot can develop as well, so you have to worry about those things as well. Infiltration, if you're not actually in the vein and you flush, you can get fluid into the surrounding space and the IV will not work. Or extravasation, which is usually you see with if there's medications that are really hard on the body, if they're infused into the skin, you can get some necrosis of the skin. So those are some complications of IV therapy. The last thing you need to do is learn how to appropriately document the IV. The things you want to make sure that you do is you have the right patient, you document the location of the IV, the size of the IV catheter, that it is patent, that you flushed it, and then what you flushed it with and what type of IV fluids. And that concludes how to start an IV. Good luck and thank you.